I hope you're ready because today we're going to get a little in-depth on the MedMutual Market Classic 1000 Gold. How's it going, everyone? I'm Joey Gingola with Gingola Insurance, and today we're going to go in-depth and break down step-by-step, part-by-part, Medical Mutual's Market Classic 1000 Gold plan. We're going to go line by line and tell you exactly how each benefit's going to work and what you need to know. So sit tight, strap in, grab a nice beverage. You're going to be here for a few minutes, and I hope that you enjoy the information. But before we get into this, you're also going to want to think about downloading, when we're done with this video, the free 5-part video series that I have put together. And it's actually going to, there's one key video that you're going to want to watch in there after you watch this one. And it's going to tell you how to actually compare these plans, besides from benefits, but dollar for dollar as far as the financial end of it, what they pay out, what you pay in, and what's going to make the most financial sense for your specific situation. So go ahead, click on the cover right here to do that, or there is a link below if you want to grab it after the video is over. So we're going to hop behind the computer right now and dive into the MedMutual Market Classic 1000 Gold. All right, so what we're looking at here, this is the breakdown of the MedMutual Market Classic 1000 Gold plan, which is available through Ohio's health insurance marketplace. And what we're going to do, we're going to go line by line here and explain to you exactly how it works. There's a lot of questions how they break this up, even with their summary of benefits and kind of regulating how insurance companies have to present information to you. It still is very hard to make sense of, and we're going to help you out with that today. And very simply, we're going to start at the top. Our first line here is the deductible, and as you can see, we're dealing with, we have two columns, and we have in-network and non-network. And it's very important here because this is going to determine how the plan works. In-network means you're going to an approved or preferred doctor, hospital, medical facility that Medical Mutual has worked out a deal with. That's what a network is. And it's pretty extensive, it's pretty robust, there's a lot of options, and you're going to want to do everything you can to stay within that network. Now, Medical Mutual does have a very handy option. Find a doctor right on their website, and you can go ahead and you can go ahead and use that, and that will allow you to look up your own doctors and hospitals to see if they are in network. So looking at the network benefits here first, you can see that you have a $1,000 single deductible and a $2,000 family deductible. Now this is where it gets a little confusing for people, and if you're buying the plan by yourself, then you only have one deductible, which is $1,000. If you're buying it with two or more people, then you have two separate $1,000 deductibles. Those two separate deductibles can be met by any combination of family members, so it doesn't matter, you just have two of them. What that essentially does is allow you to split that up, because the likelihood of something happening to multiple people in the family at the same time, again, is unlikely. So instead of paying a full $2,000, it's possible that you could only pay $1,000 for one family member, and then maybe 6 months down the road have to pay another $1,000 for another family member. But the total family deductible is $2,000. Now you can see on the out-of-network, the non-network, it's going to get a little more expensive, and it will be $3,000 and $6,000. And the next line down here is the maximum out-of-pocket. This is the total amount of money that you could spend throughout the course of the year on any covered medical services. So this is the ultimate, most important number, in my opinion, that you should be concerning yourself with, and really deciding whether or not this makes sense for you. So for this plan here, the maximum out-of-pocket for a single person is $5,000. For a family, it's a total of $10,000. So again, going back to the split versus together, basically how this would work is one person would have a $5,000 out-of-pocket max, and another person would have another $5,000, totaling 10 grand. Now, you also notice to the non-network side, it says unlimited. Basically, there is no out-of-pocket max limit. So if you are going out of network, there's one big major incentive to make sure that you stay in network, as there is no ceiling for the payments to stop. There is no limit on how much you can pay going to an out-of-network facility. And on the next line down, you will notice it says Accumulation Method. And this is very important, and the fancy insurance word here is embedded, and that means split. The other word that you would see in this spot here would be aggregate or aggregated, which would mean together. So we're going to run into this on the health savings account plans, and you'll see that here in a future video as I'll break down more of these plans. Basically, that means they're going to split the deductible up for two 2 family members. Now, the out-of-pocket max is going to make a little more sense in relation to the deductible when we look at the coinsurance. And coinsurance on this plan is 20%, meaning you're going to be responsible for 20% of the bills after you've met that deductible. So let's just take an example of one person in your family meeting that $1,000. Let's take the example of an MRI test. Let's just say it's going to be around $3,000 for that MRI. So you're going to pay for the first $1,000 of that. That means that there is $2,000 left for you to split with Medical Mutual. Basically, Medical Mutual will pay for 80% of that, and you're going to pay for 20%. So that works out to about $400 out of your pocket, and Medical Mutual is going to take care of the other $1,600. So now you continue to do that. Continue to paying the bills at 20% until you hit that $5,000 limit. Now, if you notice over again into the non-network column, it goes up to 50-50 where you're splitting the bills. So while there's no out-of-pocket limit, you're going to be splitting the bills after that deductible, whether it's $3,000 or $6,000. You're going to continue to split them 50-50. So using that MRI example again, let's say you've already met your deductible and you have another MRI, which is $3,000. You're going to pay $1,500. Medical Mutual is going to pay $1,500. And you're going to continue to do that on anything that happens out of network that you have done. It's important to note that on network versus non-network, any emergency service is going to be treated as an in-network service, basically. So if you have an accident, whatever else have you, you're somewhere on vacation, you just have to get rushed to the nearest hospital, that's going to be covered as an in-network procedure. So don't worry about that. Don't try and whip out an iPad in the ambulance to look up a doctor or a hospital to make sure that they're taking you to the right place. All emergency services will be covered as a network. Only thing you're going to want to make sure of is that after those emergency services are performed, you want to tell somebody, if you're not exactly all with it, to make sure to ask once those services are complete if it is a network facility that you did land at, and if not, then you might want to consider being transferred elsewhere. So again, that's something that you definitely want to think about, and don't shoot the messenger on this. I'm just kind of give you the best advice on what to do in that scenario. So this is ultimately some of the most important things to understand about how the plan works. So let's go ahead and move our way down here. And it's dependent age period maximum. Basically, age 28 is how old you can be. So once they turn 28, at the end of their month that they turn 28, they would have to come off the plan. So benefit period, January 1st through December 31st. This is very important. Regardless of when you purchase the plan, that deductible is going to run, and that coinsurance and that out-of-pocket max is going to run from January 1st until December 31st. So it doesn't matter. You could purchase the plan in February or March. It doesn't matter. It's still going to roll over again at the end of December. So now we're going to get down to the copay part. For this plan, to see your primary doctor, you're going to have a $25 office visit copay. That means every time you go see him that you will pay just $25. For a specialist and for an urgent care visit, you will only pay $50 per visit. And you notice that it says 0% after. So basically, once you hit the deductible, then everything's going to be taken care of for you. And the same thing, I guess I should have mentioned as well, for your out-of-pocket max. Once you do hit those limits, those numbers, that $5,000, that $10,000, in-network, Medical Mutual will pay for the rest of the covered in-network services throughout the year. So now let's move into the Preventative Services tab here. And you will see preventative services covered under the PPACA. That stands for Patient Protection and Affordable Care Act, or short Affordable Care Act, or otherwise known as Healthcare Reform, or Obamacare. All the same thing. Basically, the preventative services that have been outlined by the law are going to be covered at 0% coinsurance to you. So basically free of charge. You're not going to have to pay anything for those preventative services. And you can also see here preventative labs, x-rays, and medical tests that are not covered under the PPACA regulations. They're going to just apply to your deductible. So you will pay that full amount up until you've hit those points, and then you're going to go into the coinsurance from there on out. And that's how all of these services are going to work. Preventative immunizations, endoscopic services, prostate-specific services, pediatric vision is going to be 100%. That has to be included. Pediatric vision hardware, that's going to, again, fall under the deductible and coinsurance. And you also have routine physical exams and well child office visits That's up to age 21. That's pretty old. Those are both going to be covered before the deductible and co-insurance. And again, as well, the same co-insurance deal is going to work for the out-of-network, where it's all 50%, no matter what, preventative services or otherwise. Anything that is taking place out-of-network is split 50-50. So you have your outpatient services, allergy testing, diagnostic lab, emergency use of the emergency room. You will have a copay for that, $250. Emergency physician and ancillary services, 20%, so that's going to go to the deductible. Now this is very important. Non-emergency use of the emergency room, that's not going to be covered. So if you go to the emergency room for a sinus infection, you will have to pay the full amount, and it's not going to apply to your deductible. So don't do that. Not good. So speech therapy, you will have 20 visits per benefit period, which is 20 visits a year, and that will apply to your deductible. So you can see anything that says 20% after the deductible, there is no copays for it. You're going to pay the full amount up to the deductible. Once you meet the deductible, then you will start splitting those bills for those specific services at 80/20 with Medical Mutual. So you also have occupational and physical therapy. You got 40 visits a year. Cardiac rehabilitation, 36 visits a year. Chiropractic services, 12 visits a year, or benefit period. Again, when I say a year means January 1st to December 31st. That is what it means, or benefit period as they have stated here. Pulmonary therapy, 20 visits a year. Surgery, obviously, all this is covered, and it's going to go to the deductible and then co-insurance. And the mental health and substance abuse office visits, you do have a $25 office visit copay for that. So let's go ahead and inpatient services here. Semi-private room and board is going to be covered, and it's going to apply to the deductible. Maternity is also, now that's one of the new mandated benefits that is included in all plans. That's going to be covered. That's a huge benefit to a lot of young families out there, married couples looking to start families. Maternity care is just going to go to the deductible. Once you meet the deductible and out-of-pocket max, everything's going to be covered. So that's a huge benefit if you are in the need for it. Mental health and substance abuse covered, again, 80/20. All of this is going to the deductible. You have physical rehabilitation. You have 60 days per benefit period of physical rehab. Skilled nursing facility, you have 90 days per benefit period, and then also surgery as well. And again, the non-network continues at 50%. None of this is going to change. Additional services here: ambulance ride, durable medical equipment, home health service visits. You will get 100 visits of those per benefit period. Hospice services, diagnostic imaging. So that's like our MRI, CT scans that we were talking about. Organ transplants also covered. Private duty nursing. All of that, again, will fall under the 80/20 rule here. And you also are going to get prescription medication copays with this Market Classic Gold 1000. Generic, this is retail. It's $15 for a 30-day supply. If you're going to do mail order, which is a 90-day supply, it will come with a $45 copay. Preferred brand name drugs basically means the brand names without a generic that Medical Mutual likes. They're going to give you a $30 copay for a 30-day supply retail, or $90 copay for a 90-day supply mail order. You also have your non-preferred brand name drugs. Again, preferred brand names that do not have a generic alternative that Medical Mutual is not very friendly with. Well, they're going to come with a $50 copay for a 30-day supply, or $150 copay for a 90-day supply mail order. And then you have your specialty high-cost drugs. This is where things get a little interesting. You have in-network retail 20% up to $150 maximum. And then for mail order, you have 20% up to a $450 maximum per prescription that you fill. So then here we have notes and some stuff, fine print. I'm not going to go over that. You can read through that. I will probably put you to sleep a little more than I already have. So that is it. That is the basic overview of the MedMutual Market Classic 1000 Gold. I'm going to encourage you now to go ahead and download this free 5-part video series. You can watch it instantly, and basically what it's going to do is walk you through each step to how to actually apply for these plans that we just went over. And the reason you're going to want to do this is because in the 4th video, there is a plan comparison and analysis, which actually goes through the dollars and the cents and breaks it down and shows you a very simple formula on how to discover if this plan, the Gold 1000 plan, is going to make the most financial sense for you. Without it, it's really, you're missing a piece of the puzzle. And if you don't go through that process, then you could essentially buy a plan that you're spending too much on, and it isn't going to actually work the way that you need it to. So if you want to go ahead and do that, click on the cover of this video series right here, or there is a link below in the video's description. So again, I do want to thank you for taking the time to watch this video. I know it was a little long, but hopefully you were able to get something out of it. I do appreciate it very much. And of course, I am Joey Jingola with Jingola Insurance. Take it easy, everyone.